Welcome back, my YouTube family. Thank you so much for coming back, watching my YouTube videos. If you haven't met me before, my name is Saima Nadeem. I'm currently practicing here in the UK as a nurse. So in today's video, we are going to talk about if you have any chronic illness, if you have, let's say, chronic backache, or if you have any physical disability, can you work in the UK? Should you apply for a job here in the UK? Should it be a nurse job or something else? So this is all we are going to discuss in this video. If you are interested, please watch the video till the end. Thank you so much. If you are new to this channel, I provide information about UK nursing, how to become a nurse here in the UK, and everything around me. And if you are new, I would like to say a big welcome. If you are a returning viewer, thank you so much for your support, and I welcome you on board for the newcomers. So let's start the video without any further delay. So if you have any chronic illness, let's say you have backache and you are appointed as a medical nurse, what should you do? Should you say yes or no? And should you tell the interviewer? Yes, I would suggest you to tell the interviewer, but yes, you can apply for the job. You should, if you are hired by the interviewer, that's very, very, very good. And then there is support available for you guys. So there is nothing to worry. So let's say I have backache and I'm thinking, should I apply for a job? Can I work in the UK as a nurse? So answer to this question is yes, you can work here in the UK as a nurse. And then the process, what happens if you have chronic illness, what happens if you have chronic backache. So you are usually seen by the occupational therapist first of all, and then they make some changes, they make some amendments to your work routine and to the area of your work. So your manager should refer you to the occupational health, and then your manager should refer you to the occupational health, and then occupational health, they will see you, they will make an appointment for you, and then they say that you need to work, you cannot work in a very busy department, or you cannot work in the area where there is a lot of repositionings. So what happens, your manager is the one who will decide whether you should work in that particular department or they need to redeploy you. So if someone has any backache problem, if someone has any chronic illness, or if someone uses crutches, or if someone uses stick, this is the process we follow here. You will be given a job. There is no problem with that. There is no problem at all. But make sure you declare it at the interview. Tell them that you have this problem. Or if you have any yeah, I'm just giving an example, taking backache, all right? Because someone asked me earlier also, if someone has backache, should they work in the NHS or should they work in a GP surgery? So this is the answer. Yes, you can work in the NHS. You will be seen by occupational therapist, and they can make changes to your work environment, to your work area. So they will not allow you to work if you have, let's say you have chronic illness, chronic backache, and you cannot turn the patients. And if you're working in a medical ward, there will be a lot of turning for the patients. If you're working in elderly medical ward, there will be a lot of turning for the patients, repositioning for the patients. So you may need some help. So what you're gonna do in this case is, you need to ask help from your manager, and always ask help from your colleagues if someone is available. But let me tell you guys, NHS is very, very, very busy. So you should tell them at the interview that you have this problem, so maybe they can assign you in a different ward. All right, what I mean by a different ward, they can assign you in a daycare, they can assign you in a outpatient department. Because what happens in the outpatient department is they take the patients as appointment basis, as per appointment. So if someone has appointment for 9 o'clock, next appointment will be 10 past 9 or 20 past 9. So there is a gap of 20 minutes, 10 minutes. And also in outpatients, you don't give personal hygiene care, you don't reposition them, because outpatient, as you all know, is OPD. So patient comes there only for appointment, they stay there for 30 minutes, or they come only for a small procedure, they don't stay there for long. So there is no such kind of works like personal hygiene, repositioning, pressure ulcers, things like that. So if you are thinking about it, if you don't have if you have OPD experience, outpatient experience, or day surgery experience, well and good, tell them that you want to work in that particular area. If you don't have that experience and you are appointed in a medical ward, or you are appointed in a cardiology ward, in any ward, just tell your manager that you have this problem, and they can refer you to the occupational health. And same thing, when occupational health says that this person cannot work in this ward because of the severity of the patient or because of the dependency of the patients, then they can redeploy you. They can send you in any other ward. So when they redeploy you, it means they assign you to a different area, let's say OPD or daycare, and then there you don't have this kind of work where you need to use your back a lot. All right, another option your manager can suggest is, or your occupational health practitioner can suggest, is that you can work as non-clinical. Non-clinical means you will not be doing work with the patients. They can also you can also work as a clinical nurse, but you will not do the patient care or repositioning. Also, you can work as non-clinical nurse. All right, non-clinical, what does that mean? Is they will give you office work, like reception work, or something to print or scan or make files or something like that, like clerical work. They can still find something for you. So no, don't hesitate to say no at the interview, or don't hesitate that you will not get a job here in the UK. Yes, you can get a job here in the UK. There is work for you guys. You are experienced nurse, you are a nurse, so there is loads of opportunities for you to work in the hospital. Whether you can, if you cannot work, if you feel like you have backache and you cannot you feel like you cannot work here in the NHS, it's wrong. You should apply and you can still get a job here in the UK. There is a lot of different kind of work for you available, but it depends on your manager what she decides for you and what is the option for you. And of course, they will ask you if you are happy to do that work. Your manager, she's gonna ask you if you are happy to do the non-clinical work, and if you say yes, then they will assign you that work, so you don't have to use your back a lot there. All right, so I think I made it clear. Your questions are answered. So she asked me if I have backache, should I apply in the NHS or GP surgery or private care home? Yes, you can apply in the NHS. They can make amendments in your work. They can redeploy you in the other department. You can work in a daycare. You can work in a OPD with the backache. All right, but later on, when you get NHS experience, if you want to change, I would suggest you can work also in the GP surgery. What happens in the GP surgery? GP surgery is more like a clinic. So patients come there and they see a GP, and sometimes they have something for the nurses, like vaccinations, dressings, or injections, or nebulization. So things like that. When the patient comes to see the GP, if they have something for the nurse, that patient will go to the nurse. If they don't have anything for the nurse is free there. All right, so appointment basis. GP surgery is usually appointment basis. You are not running around. If I work in the NHS in the ward, I'm very busy. I have 10 patients. I need to provide personal care to those 10 patients. I need to give medication to those 10 patients. I need to serve breakfast, and then again things like that. Like all the day you are very, very busy. You are running around. Okay, NHS is very, very, very busy. All right, so I would suggest for you, with your chronic illness, if you are happy, you can work in the GP surgery also. And let me tell you that in the GP surgeries, most of the time they require well experienced nurses. All right, if someone has experience here in the UK, if someone has experience in the NHS here in the UK, you are more likely to get the job in the GP surgery. But GP surgeries are really good. They are easy than the NHS, and it's easy to work in there as well. So in short, yes, you can work as a nurse here in the UK with some chronic illness. I have seen nurses with walking with the crutches. I've seen nurses here in the UK walking with the stick. I've seen nurses with wrist injuries, with backache, and also I have seen nurses on the wheelchair. So don't think that you cannot get a job here in the UK with physical disability or chronic illness. It is possible, and there are lots of opportunities for you guys even with the physical disability. They don't take it wrong. Honestly, there are lots of people with physical disability. They work as a nurse here, they work as a receptionist, they work as a sport workers, and most of our staff, they are also patients. They are patients also. So you can imagine that they don't discriminate you because of your disability. So it's your chance to apply and get hired. All right, so this is all we discussed in this video. If you have any questions about any problem you are facing, or you are coming to the UK, if you have any doubts, let me know in the comment section. I hope, Hina, I answered your all queries. You can become an UK RN with the physical disability. It is your chance. Don't delay your dream. Just apply, and then good luck. I'll see you soon. I'm wishing to see you soon here in the UK. And that's it. If you like this video, please share it with your friends who are coming to the UK or who are here in the UK, or if someone has any disability, please share this video with them so they can benefit from it also. I'll see you soon in the next video. Take care. Bye bye. God bless you.